Hi, everyone. Good evening. Welcome to another webinar by ODOC. I know it's been some time since we had our last ODOC webinar, but we're so glad to be back in this month of October. As everyone knows, is the Breast Cancer Awareness Month, and no other better topic to do our comeback webinar with other than this. So today's topic, as everyone knows, it's about early detection and everything you need to know about breast cancer. And to speak with us and to give us more information on this, we have Dr. Nuwan Gunapala. Thank you so much, Doctor, for taking the time off your busy schedule to be here with us. Just a quick introduction about Dr. Nuwan is he graduated from the Colombo Medical School and has been practicing for over 10 years. And in the past few years, he's been specializing in breast surgery. So Doctor, would you like to just start off by giving a little background about you? You mentioned that you did the surgery, studied surgery in the UK. So we can just give a little background about yourself before we jump straight into the questions about breast cancer.
All right. Good evening to all. First of all, let me thank to ODOC team for giving me this opportunity to discuss the breast diseases with the public. And so if I talk about myself, I was selected to surgical training in 2014, and then since then I was training in general surgery. And then for my specialty, I selected breast surgery. And for last 3 years, I've been in UK doing breast surgery, only breast surgery. I had mainly breast clinic and operating on breast cancer patients. So they have much developed breast cancer services compared to developing countries. So it was a good opportunity for me to learn about breast diseases. At the moment, I'm working at Khawatta Hospital in Ratnapura area. And again, I'm practicing general surgery with, I'm treating breast cancer patients here as well.
Great, Doctor. Thank you so much. So to everyone who's watching, please feel free to send us your questions. At the end, if time permits, I will take a few viewer questions, Doctor, if you don't mind. But before that, Doctor, the first question I want to ask you is, I read online, I was writing a blog about breast cancer, and I read online that breast cancer is the most common cancer in the world. But when you take for Sri Lanka, how true is that? If you could just give us some stats, or like incidence of like breast cancer, how prominent is it prevalent is it in Sri Lanka?
Yes, yes. As you correctly mentioned, worldwide, globally, breast cancer is the commonest cancer, and in Sri Lanka also it's the same. And that in Sri Lanka, but the trend is increasing rapidly. Like if I tell you about incident, it's like 40 patients per 100,000 population, right? But that rate is rising 4% by each year. Initially, breast cancers were more common in developed countries, but now the trend, like they have stabilized, stable amount of disease, but in like developing countries, catching up to their level. I think it's mainly because of our lifestyle changes and dietary habits. For example, last year we have diagnosed 4,000 new breast cancers. That is only data from the Cancer Hospital Colombo. So it's, I think, severely underreported because most of the peripheral stations, they don't report the breast cancer incident. So I think, as you mentioned, breast cancer is the commonest cancer in the Sri Lanka as well. If you look at the second most common cancer, that is oral cancer and also throat cancer in males, it is up like 20, it's like, 2,000 patients per year, but breast cancer is almost double. So you can see the difference and how common it is in the country.
Great. Thank you for shedding some light on that, Doctor. I think putting some numbers behind it really gives you the reality of the situation in the country. Another misconception that I've heard very commonly being spoken about is that breast cancer only happens in women, which is very untrue. So could you just shed some light on how men can also, before we move on to breast cancer in women, I want to just talk about how it affects men and like things that they should maybe look after or keep an eye out for?
Yeah, actually, that's a very good question. Because of that misconception, even though males, they have symptoms, they don't care They think just I have just lump and they don't come for medical services. But when they come, it is almost advanced disease beyond the treatment. So if I talk about the numbers, in Sri Lanka, we don't have exact data, but in developed countries, if you diagnose 100 females, you can diagnose one male breast cancer. So it's like 1 in 100 female breast cancer.
Great, doctor. Thank you for that stat. Just talking about breast cancer, doctor, like any other cancer, I'm guessing it happens in stages. Could you just walk us through the different stages of breast cancer and where you think people should be, where they should take the most amount of care, or where they should be more maybe have to look out for it more? If you can just walk us through those stages, please.
Yes. So just before coming into that, I would like to explain actually why we have an awareness month for breast cancer.
Sure, doctor. Please.
If you look at rectal cancers, oral cancers, we don't have such a month. So why is that? So main reason behind that, one thing as we already discussed, it is the commonest cancer in the world. And the second one, they present early with simple symptoms, like anyone can detect early. So if we catch them early, we can treat them and the outcome will be much better than diagnosing them late. But other cancers, if we look at the rectal cancers or bowel cancers, they don't have such symptoms which help them to diagnose it early. So that's why we have awareness month. If you increase the awareness among the population, so most of the cancers we can detect early, which will invariably leave us with a good prognostic patients. So coming back to your questions, the staging system is very complex and it is very technical. So I would like to give you a very simple system everyone can understand. So basically, we can discuss it in three categories. One thing is we call it early breast cancer. And the second category, we call it like locally advanced breast cancer. And the third one is advanced. I'll explain what these categories mean. So if you look at the breast anatomy or the structure of the breast, it has breast glands as well as fatty tissue. So cancer mainly occurs in the breast glands, that is glands that produce milk. So those are very sensitive to hormones, especially estrogen hormones, and they changing, like those are very dynamic tissues. Like if you look at a female going through her periods or her menstrual cycle, they will face these changes. Like before periods, they have very tense, engorged breast. That is because of hormonal influence. So once when this hormonal action is too much, what happens? They start overgrow and it goes out of control, and this can convert into cancer. So early cancers are cancers which happens inside the breast glands and it does not infiltrate into adjacent structures. Cancer can spread by either infiltrating into a local muscle or it can go through lymphatics, that is we call a lymph fluid in the body, and they can spread into lymph glands. So either it is not gone through the lymphatics or lymph glands or not invaded into the local structures. That is called early breast cancer. That has the best outcome if we diagnose it early. We have a number of treatment options and we can actually save the breast even, because most of the time we think if we have a breast cancer, I have to undergo mastectomy, that is removal of breast. But if we detect it early, actually we can preserve the breast, and almost we are looking at a curable disease at this stage. So that's very important to detect it at this stage. We call it early stage, that is without any spread into the local structures as well as to lymph glands. So then comes the second group. What happens when cancer grows further? It spread into either local structures or it goes through the lymphatic to the lymph glands. So that is called locally advanced cancer. That means it has spread into the local tissues. Even this stage we can treat, and we have many surgical options as well as other medical options. But the overall prognosis or the outcome would be poor than early stage breast cancer, right? So obviously the last one, we call it advanced breast cancer. What happens? The cancer has spread into the lymph glands. From there, it will spread into the liver, lungs, bones, spine, and brain. And so it's a widespread disease, and most of the time that is beyond our cure. They have short life expect. So those are the basic three groups, like early breast cancer, that and the locally advanced and advanced breast cancer.
Great. Thank you so much, Doctor, for explaining it in a very understandable manner for us people who don't come from a scientific background. Just moving on to my next question, Doctor, which is actually stemming from one of your answers you gave us, that you said the earlier we detect, the better, the more chances of full recovery. You were talking about, so two-part question. One is, how can someone self-examine, or what should their practices be in order for doctors to be able to detect early on itself? And the second part of the question is, you mentioned multiple treatment options which will be available the earlier you detect. Could you just tell us a few of those options?
All right. So coming into the self-breast examination, that is very important, especially to Sri Lanka. If you look at other developed countries, they have well-established screening program. So all the females older than 35, 40 years, they will have an appointment with the breast doctor, and they examine their breast and they will have a mammogram. But in Sri Lanka, we don't have such established system. So most of the time we see patients, either they come uh, after seeing a lump. Most of the time, as I mentioned earlier, it could be a locally advanced cancer by the time we diagnose. So, so as we don't have a proper screening program, self-breast examination is very important. So all the females roughly aged beyond 35 years should practice self-breast examination. That is because most of the cancers we diagnose after age of 35, the age area between 35 to 50 years. So it's a very simple and everyone can do it. It's not a big scientific method, right? So if I explain how to do self-breast examination, so it's easy. You can do it while you are having a wash, or whenever you have private time, you can do it. And usually ideal timing is 5 to 6 days after your periods, because that's the time your hormone levels are low and breast is at the normal baseline level. So once you start your cycle, the breast become engorged and tense, and you might miss small lumps. So if everyone can see, it's like you can stand in front of a mirror and just observe your breasts. Especially you look for size and symmetry. Usually, most of the female, one breast could be bigger than other. That is normal. But if you see one breast becoming bigger quickly in a shorter period of time, that is significant. So always compare size of the both breast, and then look at the nipple and see how they are directed. They usually look outward and downward. That is normal rotation. If you can see one nipple is rotating like some other direction, that means there is something pulling it from inside. So that could be a cancer. So look at the nipple, then look at the skin, right? Skin, you can see whether there are any ulcers, swelling, redness. Those are the features of cancer. Then you can start by lifting your both arms, same time looking at the breast skin. If you can see some skin is pulling inside, we call it dimpling of the breast skin. That is also sign of a breast cancer. Then you can go to feel your breast. You can keep your hand behind your head, which will stretch the armpit and the breast, and then start feeling breast. There are various methods described. If you go through Google, you can see various methods. But baseline is you can't miss any part of the breast. So they are described like clockwise palpation, up and down, vertical strips. Whatever the method you use, you should not miss any part of the breast. And we recommend to use finger pads to feel the breast, and you examine whole breast looking for any lumps. When you do this for several times, you know the structure of your breast. We call it breast aware. So you know the structure of the breast and how you feel it. Then next time, if there's any change, you can detect it early, because you know the baseline, then you know the change. After palpating feeling your breast, then you can feel your armpits for your lymph glands. You might feel tiny lump. It's like a rubber ball. That's most of could be a lymph node. And that is the basic self-breast examination. I'll briefly mention what are the other signs and or the clinical features of breast cancer. Uh, First of all, I would like to say breast pain is not a significant clinical symptoms, because when I was doing clinics in the UK, most of the females coming with breast pain with unnecessary anxiety. Before that, the common thing is a lump. You might feel a lump underneath your finger pads. That's a common symptom. And then you might have skin changes, like when you're lifting your arms, you will see dimpling. And the nipple discharge, that is also very significant thing. If you see bloody discharge from one side, that is significant. If you have discharges from both sides, which is clear, that is not significant. That is we call physiological. But if it happens only in one side and if it contains blood, that is significant. And then sometimes you can see the thickening of your skin. We call it like orange peel appearance. If you look at the orange peel, you can see tiny pores, multiple tiny pores. So like that, your skin become like orange peel. That is because of the blockage of lymphatic causing swelling of the skin. So those are the basic things you should look out when you do self-breast examination.
Great, doctor. Thank you. And that the same self-examination, it's the same for men also, right? Just wanted to make clear for our viewers.
Yes. Yes.
Great.
Yeah. So men actually they don't have the bigger breast tissues like females. So they can just feel around their nipple, and then if they can check their armpit, I think that would be much better. And actually, we don't specially discuss about self-breast examination in men, but like in female especially, we recommend to do them like monthly duration. But in males, not like that. Maybe if you're worried about, you can check yourself.
Great, doctor. And then to the second part of the question, like you mentioned about treatments, would you mind letting us know what sort of treatments is out there, especially what's available in Sri Lanka? Because, I mean, when we Google it, everything that comes up is abroad. We don't really know if it's available here or not. So if you can just give us a little bit of information on that, doctor.
Yes. So if you look at surgical field, the breast cancer management is evolving very rapidly. What we used to practice last year is not correct this year. So that much of research is happening around the world because it is much common, and so it's evolving very rapidly. So now Sri Lanka, we have actually 7 surgeons who specially train for breast cancer management. Apart from that, also cancer surgeons also dealing with breast cancers. So if you have any worrying symptoms, you can go to your GP and get a referral to one of the doctors who's looking after breast cancer. So looking at treatment, still in Sri Lanka, especially in this peripheral area, they think if you have a cancer, oh, I'm going to lose my breast. So that's the one reason they are not coming for medical follow-up and assessment as well. But I would say that management was like that's a practice around 1980s, 70s, right? So now we rarely remove the breast for breast cancer. So almost all early stages, as I mentioned previously, the early breast cancers, we don't remove breast. We call it wide local excision. We just go to the tumor and we take a tumor with the margin of normal tissues around. And we have various surgical technique and we can fill that defect. So at the end, you will have almost normal shaped breast and cancer is out. And we don't stop there. Then you should have radiotherapy. That is, in common language, we call current treatment. So that is, you will have radiation to your breast to kill whatever the remaining cells. And then we analyze the removed tissue. We call it histology. We check it, and depending on the cancer characteristic, we can give chemotherapy. And also we have newer treatment we call hormonal treatment, which doesn't have much side effect like cancer treatment, the chemotherapy. And if we coming into the next stage, we call it locally advanced, then even that does not need mastectomy. If they have a large tumor, what we start chemotherapy before the surgery. So what chemotherapy will do, it will shrink the tumor, and then we can remove small part of the breast and preserve the breast. They will have a chemotherapy regime much bit aggressive than the early stage, and also they have to undergo radiotherapy. So advanced disease is the problem. They might end up with mastectomy. Rather than that, they will have aggressive chemotherapy. They have common side effect like losing hair, loss of weight, the problematic chemotherapy. So that's the like roughly overview of the management of breast cancer. Now, with the newer research, we are trying to start new hormonal treatment. Probably ultimate goal is to avoid the surgery. So we are planning to manage breast cancer with only medication without any surgery. So maybe in another 5-6 years, we can go there.
That is so promising, doctor. Thank you for sharing that. We've just been told that we have a lot of new people who've joined the webinar in the past few minutes. Just a shout out to you guys. If you have any questions that you would like to ask Dr. Nuwan, please put it in the comment section below. If you want to ask in a more private manner, you can always just DM it to ODOC, either on our Instagram page or on Facebook. And I will, if time permits, I will definitely ask the doctor your questions. Moving on to my next question, doctor. One thing that I've heard a lot of people say is that the more you breastfeed your children, the less chances of you having breast cancer. Is this a myth or is this actually true? If it is true, how does it help in reducing the chances of you developing breast cancer?
Yes, so that's a good question actually. So give a short answer. Yes, that is true. So theory behind that, as I mentioned previously, in our breast we have breast glands, which is very responsive or sensitive to estrogen hormone. So if you look at female lifespan, they attain their puberty, and from that point onward, they are exposing to their estrogen hormones. So if you have early puberty, risk is high, and then the next landmark is first childbirth. So that is after childbirth, your hormone composition change into progesterone that is protective. So if you have a late puberty, risk is low, and then if you have a first kid early, then again risk is low because the duration of exposure is minimum. Then if you have many children, again risk is low, and if you breastfeed them, again that is progesterone, so risk is low. Then what happens afterwards? They try to go for a family control methods, and they take oral contraceptive pills. That is again estrogen. There's a slight increased risk in that. And then what happens? They stop their menstruation. We call it menopause. And if you have late menopause, again the duration is longer and the risk is higher. So if you have late puberty and early menopause, risk is low. And after that, some people tend to take hormonal replacement therapy. They replace estrogen hormone. Again, their risk is slightly higher than the normal population. So as I told you, if you have more kids and breastfed more years, risk is much lesser than the normal population.
Thank you for clearing that out, doctor. Before I go on to my next question, we've actually got a DM. This lady, anonymous, would like to know if itchiness of the breast, if she should consider it as a sign or if it was something else completely unrelated to breast cancer. Persistent itchiness.
Yes, so that depends on the place where she has itchiness. If it is under her breast, that could be fungal infection. We call it intertrigo. And if it is around the nipple, and if there's some scaling skin, that is significant sign. It could be dermatitis, that is a condition of the skin, or it could be a sign of a breast cancer as well. So I think better to get examined by one of the breast specialists.
Great. Thank you, doctor, for that. My next question is, at the beginning, when we were talking about the stats of incidence of breast cancer in Sri Lanka, you said it's obviously on the rise because of changes in lifestyle and everything that we are as a community going through. So how can we reduce or minimize the risk of us developing breast cancer? What are the 5 top things that we can do or change or be aware of, other than the stuff that you said, like more kids and breastfeeding? Other than that, if there's anything else.
Yes, so if you look at other modifiable risk factors for breast cancer, the first, the key thing is alcohol consumption. So there's obvious or the direct association between the alcohol consumption and breast cancer. So minimal consumption of alcohol, And then smoking also associated with breast cancer, but it is not that strong relationship with breast cancer. So basically, minimal smoking, minimal alcohol, and the next most important thing is body weight. So if you maintain the low body weight, risk is lower, and especially in obese patients, again risk is higher. And also stress-free life, not only breast cancer, that will reduce all other cancers. So those are the mainly four things that we can modify to reduce breast cancer.
Great, doctor. Thank you. And that brings me to my last question that I have for you, doctor. So obviously, we know that breast cancer can be passed on through your genome. But what are if you can just explain how that happens, hereditary, what are the chances of it being passed on? That's one part of the question. But the other part is, how can you screen for that gene? Is it available in Sri Lanka, the screening process? And if so, how often should one person screen, or when should they screen for it?
Yes. So first of all, let me tell you this, like screening of the breast cancer, it is not genetic studies. It is mammogram. It is the mammogram, right? So because it's like a filter check for breast cancer, it will examine whole breast. If you do an ultrasound scan or the jelly scan, that does not examine whole breast. So it's the test around the whole world is mammogram. So that's why if you have any symptoms, even without symptoms, better to have a mammogram by the age of 40. That is the normal practice in developed countries. So coming back to genetics of breast cancer, if you have family members, like not a single one, but if you have many family members in your family, there could be associated gene. We call it BRCA. There are two, type 1 and type 2. So we call it BRCA1 and BRCA2 genes. So recently, maybe not recently, but if you know about Angelina Jolie, she had that positive BRCA gene, and she had, we call it prophylactic mastectomy. She removed her breast before the cancer happened. So if you have a one family member, like old age female in the family, that is not because of genetics. If you have genetic risk, you should, or the family member should have the cancer at early stage when they are young. And usually they have more than one family member in the family. So if you have that risk category, like you have multiple family members at young age, yes, you should consider doing BRCA1. Other than that, if you have one family member very old age, don't worry about genetic factors. Coming back to your second question, do we have it in Sri Lanka? Yes. If you want to do it like low budget, it's available in the Colombo Medical College. And even in the private sector, I don't want to say their names, but it is available in the main laboratories, and price is around 40,000 rupees. And soon it will go up with the economic crisis, but at the moment it stays around 40,000. And if you Google it, you can straight away get an appointment and book for BRCA1
Great, doctor. If you don't mind, we've got some more questions from our viewers. Is that okay if I ask you those? One question was related to one of your previous answers. You said early detection means you can remove the tumor very easily. But what are this person's asking, what are the chances of it reoccurring? Is there a chance of it coming back later on in life? Even with a full-on removal? Yeah.
Actually, this is one of the big topic we debate in the between breast cancer surgeons, because if you look at compared with the removal of the whole breast and removal of the part, right? There's a slight increase in recurrence of the breast cancer in we call it wide local excision, right? But what we have done, then we have followed up all those patients, and if you look at, we call it long-term survival. That is how long they are going to live, or around how they are going to die. Are they going to die from breast cancer? When you look at that, there is no change. But problem, when you remove a breast, the whole psychology of female is getting down, and then they try to avoid social functions. They don't go to weddings, and they are long term, they are depressed. But when you remove a part of the breast, the remaining quality of the life is much better. So answer for that question, there's a slight risk, but that does not rule out the wide local excision or removal of the part of the breast.
Great, doctor. Thank you. And with your answer, I just had another question that I would like to ask you. We always speak about patients who have been diagnosed with cancer, the chance of having it, all of that. But another side that we don't really speak a lot about is the person who's taking care of the patient, the caretaker. In that case, if someone knows someone who's been diagnosed with breast cancer, how can a caretaker look after them, or look after themselves? Are there any tips that you would like to share for the caretaker per se, rather than the patient in this scenario?
Yeah, so one good thing of breast cancer, that is not disabling of patients' day-to-day life. So they can engage their normal duties, they can go to work, unless it is advanced breast cancer with the spread into the spine causing paralysis. Most of the other people, they can live normally. So if someone is looking after patient with the end stage or the advanced breast disease, because that is the person need caretaker, they can promote healthy diet, exercise, and mental well-being. Apart from that, there's no particular special thing with regard to breast cancer that they can support, but it's a routine thing that we can do for our healthy life.
Great, doctor. With that, I think we've gone over time also. So just wrapping it up, and like you mentioned earlier, it's super important to spread awareness on breast cancer, given the rise of it in the recent past. And us as ODOC will definitely. We've actually got one more question, doctor. If you don't mind, I would like to take that.
Yeah.
So does a milk bleb in a nipple of a breastfeeding mother with no lumps detected in hand examination, no infections detected in blood, can be caused by breast cancer?
Sorry, I didn't get the first part of the question.
So this person is asking, does a milk bleb in the nipple of the breastfeeding mother, if there's no infections and there's no lumps, can it also be caused by breast cancer?
Milk bleb? What does
milk bleb?
No, there's no. Usually, most of the time during the breast feeding, it's a lump usual presentation.
Okay, all right. Thanks for clearing that, doctor. So like I was saying, doctor, at ODOC, as forerunners or leaders in the digital health space, we promise to keep spreading awareness in everything that we can do in our whatever is possible for us, and we will continue doing webinars like this. But for us to be able to do this, we would like to thank you for taking your time out. We know how busy you are with surgeries and everything. It means a lot to us, and more than to us, it means a lot to everyone who's listened and tuned in live, but also we'll be posting this on our YouTube page. It's going to help so many people. So doctor, thank you so much. And for everyone else, if you would like to consult Dr. Nuwan, he's available on the ODOC platform. And you can consult him from the safety and comfort of your homes. So I am Shivangi, and I will be back again with another session, with another great webinar. If there are any specific topics you would like us to cover, please do send us a DM, and we will try to get a doctor in and have a conversation around that topic. But until then, I'm Shivangi and the entire team of ODOC signing off. Please be safe and take care. And doctor, thank you once again.
All right, thank you very much, and have a good night.
You too, doctor. Thanks.